Okay, pay attention. If you have a patient with acute onset shortness of breath, if they're hypoxic and they have unilaterally decreased breath sounds, automatically think spontaneous pneumothorax. If it shows that the person's history has COPD, this is secondary spontaneous pneumothorax. On physical exam, look for hyperresonance. What is a modifiable risk factor that you can have to decrease the chance of having pneumothorax? That would be smoking. The pathophysiology of it basically is when you start making large blebs, and these alveolar blebs eventually rupture and they leak air into your pleural space. If they show you an image of a chest x-ray, make sure to look for the visceral pleural line and an area of transparency where you can see no pulmonary markings. If a person has COPD with secondary spontaneous pneumothorax, it's very unlikely they'll have tracheal deviation, but if you have primary spontaneous pneumothorax, that is more common. The therapy for this usually ranges. It's either supplemental oxygenation, or if the patient is unstable, you'll have emergency tube thoracostomy. Remember that ostomy means an opening to an organ. Remember that spontaneous pneumothorax, the trachea will deviate away from the collapsed lung. Now, what happens if you see it deviate towards the collapsed lung? Think of atelectasis. In a new patient who has diffuse bronchi or wheezing, definitely start to think about acute COPD exacerbation, and what you're hearing is diffuse bronchial obstruction. What happens if you hear bilateral coarse crackles? You should be thinking pulmonary edema, and this can be caused from an MI, sometimes ARDS. Now, we talked about hyperresonance to percussion. What happens if you have dullness to percussion? Definitely think of pleural fluid. Also, on auscultation, you'll hear decreased breath sounds over the site of the effusion. How come COPD patients are at increased risk for pneumonia? This is because they chronically use corticosteroids. But always remember, if someone has pneumonia, look for fever and productive cough.